Hey everybody, it's Kevin and Thea from the Remote Care Services Show. Today, Thea is remote. She is at a beautiful little spot there, right outside her working place, and then in between errands. So she's good enough to be able to run through something I feel like shouldn't be an errand for us as pharmacists. It's something that should make sense, and that's drug-induced nutrient depletion and why you should potentially start with that if you're looking for a clinical avenue to help your patients out. We'll talk to you in just a second right after this reel. Sorry, Thea. My screen was freezing on my side, so you saw my eyes darting back and forth, going, "What's going on here?" Making sure that you're still there with me. But it's so good to have you here with me. How have you been? What's the most recent news and exciting stuff in the world of Thea?
Well, always moving and grooving here in northwestern Pennsylvania. Today we have poor air quality, so I'm outside enjoying that poor air quality because the sun is shining, and so here we are. The Canadian wildfires have us foggy here. I've never seen fog like this or smoke like this before, so it's kind of crazy and exciting. But from all things, from a professional side of things, everything is moving and grooving into great things after 5 years of really struggling and pushing and continuing to do the daily actions. I've been able to keep moving forward. So it's great to see that progress, and I'm very happy to be doing just that.
I think 5 years is just, it's so commendable, Thea, like just being able to push the envelope and just evolve things and change things. But you had to start from somewhere. And I know that that was your big push for us today as a really good place to start. And then you just had some experience of going and helping out in a local retail pharmacy the other day and had this exact same conversation. So let's just jump right into it. I think drug induced nutrient depletion is something that might be a somewhat familiar to us, but can you remind us, like, what does that mean, Thea? What is drug-induced nutrient depletion for those folks that don't think of it as a pharmacist's daily work?
Yeah, I mean, I think when we look at dispensing medications, we have a little list of, known, what do I want to say, contributors to this list of medications that can really deplete our bodies of certain, different vitamins and deficiencies that way. And so it's really important just to keep them top of mind, if for nothing else. My conversation last week was really around, I have a retail pharmacist local to me, and we were talking about where to start with clinical services. And I felt like this is really low hanging fruit that a lot of pharmacies that I've been in have never really dealt with much of. And, as a healthcare pharmacist, we deal with nutrient depletions all the time in-house, but on the outside in retail you really don't get a lot because you don't have access to all of the medication panels and the lab panels.
Yeah.
So it's hard to really get a clear picture of what's going on, but you can have the conversations about things that you do know that cause the nutrient depletions in patients when you are dispensing those medications. And I felt like this was pertinent because a lot of the pharmacies are losing money on those prescriptions. And so I say, well, how can you make money on those prescriptions? And going over some of the assets you have in the pharmacy is you have a great supply of supplements out in front of the counter that get sometimes passed by a lot of patients. So my conversation really started there so that she could really take a look at maybe what are some great resources and maybe what it looks like from a implementation process in a pharmacy that's not doing this. And so that's why I kind of dove into this topic, because it's a great place to start for clinical services, I feel.
I think that's perfect, Thea. And I mean, really, like drug-induced nutrient depletion, like we can think of it in lots of different ways, but one is typically the absorption of individual nutrients can be delayed, changed, altered, or minimized by an individual drug, their mechanism of action, how they affect the gut, etc. So those are the typical ways. And the ones that come to mind right away, Thea, like which ones just kind of top of head, like there's a nutrient depletion that we often see and we usually work with?
In retail, I think of two that come top of mind: birth control for all the patients and metformin for all of their patients,
Yeah.
as those are pretty high volume prescriptions in most communities. And, those are kind of the major ones I think of. I also think of maybe the statins and CoQ10 and depleting CoQ10 in the body and that kind of stuff. But folic acid, magnesium for your birth controls, as well as vitamin B12 and and folic acid for metformin as well. So really, I think stock up on those vitamins and start putting the bag inserts in those prescription bags, because I really think that not a lot of the patients that I see that are on those medications as maintenance, they're not getting the help that they need from, and wondering why they're feeling the way they do. Oh, I feel so run down. My calcium is low. I'm not going to the bathroom, and my magnesium is low, and all of these things keep happening in conversation, keep coming up in the conversation, because they're happening to the patients in their real lives. And so from a retail standpoint, have you mentioned that to your patients? Have you asked them if they have a supplement? You're not asking for the sale, which is another whole conversation, because we don't, as pharmacists, like to ask that question if they would like to purchase it. But if you can ask the question of, are you taking it? Because we know that this drug is a high offender of depleting your body of these nutrients. It's really a great place to start the conversation. And it's a conversation that the pharmacists don't necessarily have to have, but they can inform their staff on how to have it.
Totally. And I think that looking at all the different settings where we have nutrient depletion and how we can recommend it, hospital, retail, ambulatory types of settings, in the hospital, really easy because we're looking at nutrient depletion. Oftentimes we have someone on an IV bag. We're looking at the labs. We're adding it to the bag, just in general. In the ambulatory setting, the fun thing that we can do is we can recommend and we can quote unquote prescribe supplements for individuals to be able to have that on record and get that from their pharmacy for an individual recommendation from you and the provider you're collaborating with, for them to be able to pick that up. Really adds a ton of confidence to the individual and lets them know, like, this is something that my doctor and our pharmacist combination want me to take. And so I think there's a good space there for ambulatory, but we're really going to gear this conversation or the rest of it toward the retail world, right? And how we can kind of implement things to start with there. And I love that, you mentioned a couple and how we can kind of move forward with it. One really easy one to think of, Thea, that I feel like goes missed too often is we often know that iron, right? Iron goes with vitamin C. Always the case. Iron, vitamin C. Why? The absorption goes up because we need higher levels of it. We need more acidic environments for that iron to be absorbed appropriately. But the one thing that we don't often think about is what gets rid of acidity that can then reduce iron. All those PPIs, that are on board. So that can be another one that I think of, that it can be a really readily available component of saying, is someone iron supplementation? Are they taking a proton pump inhibitor or other acid, inhibiting element? Fantastic. You've got a really good spot there to be able to help them out. All right, Thea. So let's say we love this idea. We're in the retail pharmacy and we're like, okay, but how do I start? I don't know all the nutrients that are being depleted from patients' bodies. I don't know which ones to target initially. Where do I go?
There's a great resource, I think, in the links around the Natural Medicine Association that has, they have a great research page. And then at NatMed, that he has that pulled up right there. And then he brought one up that is, what was it again, Kevin? Like the MyTaven?
Yeah, I think with the NatMed one, I love it, Thea, because it really gives you a simple, like, straightforward, very common, like, here are the ones that are problematic. It gives you a rating system to tell you if it's going to be significantly problematic and you definitely should supplement, or you should look at laboratory values or potentially supplement. And so it's really nice, straightforward, and simple to be able to have. I've got another one. Let's see if I can show you real quick, Thea, if I can pull this guy down. There we go. I had a good friend of mine that I do some consulting out of his pharmacy, and he showed me a little from Orthomolecular. They did a little
a lab company.
Right? So a lab company basically saying, hey, like a lab company plus somebody that's doing supplements, so really smart on their behalf. But it's not like you would have to use those products. In general, you could use any of your favorite products to be able to use a sheet like this. But they basically make a cheat sheet of just, here's the different categories of medications, here's the supplements that go with them, and then some of the data, that's kind of behind it. And so I think it's a really easy thing to have. The nice thing about having a cheat sheet is you can stick it right if you've got a pharmacy window. If you got your pickup counter, you pop it right there. You can give it to patients that are going to pop up. You can use it as a bag stuffer to check something on there. Anyway, that was the other piece. And then the one that you were just mentioning, Thea, that I was going to show some folks because I've talked about it a few times. And our good friend Lauren Castle, I know, knows this individual well that made this site. I'm gonna have to see if he has an API that I can plug in for future use too. But it is called Metastream Midavin. And so Midavin is, I'll back up one sec. So here's the individual site. Let me go all the way back to the very beginning so you can see the pretty purple. There we go. Okay, so here's the main site in general and kind of looks at balancing in healthcare. If we just pull up, let's say, omeprazole. So there's omeprazole there. We can find deficiencies. And then the nice thing that it does is it brings you over to here's the deficiencies that could potentially be caused, and then gives you the level of evidence and the studies related to that. And so I think it's a really useful guide. Is it a lot to be able to consume at one time? It is. But I think that's one reason why the natural med just kind of breakdown and the little cheat sheets are a really good place to start. And then when you dive a little bit deeper into studies and et cetera, then you can go there. But okay, Thea, so now we've got some info that we can mobilize and utilize. What do we do with now these resources and implementing into our patient population?
Yeah, I really think you have the opportunity to run your reports right out of your pharmacy software system and pull in what those prescriptions you want to work with. And maybe it's one medication a month, or maybe a season that you're trying to get through things. I really feel like that's a best place. If you have a student, this would be a great student project. If you have a technician who's short on hours for whatever reason, I don't think that happens today, but if so, that's another great opportunity to utilize some of their skills on, filling out the paperwork, or maybe not filling out the paperwork, but getting those papers in the right bags for your metformin patients or for your PPI patients. If you can't deprescribe those, because most need to be deprescribed, I'm going to take a lesson off of our deprescribing friends. But let's get off those PPIs so we don't have to worry about their absorption later. But anyways, I think that, looking at the workflow that you already have in place and what makes sense, maybe it's a stack of bag inserts right beside your metformin or your birth control or your PPIs that really allow you to just pick one up and put it in the bag with a refill, and the technicians can keep it together for you, and it looks nice for the patients to understand why it's important. Maybe adding some of what the patient feels, because sometimes the information that we think is important doesn't come down to how the patient feels. And if you can make it relate to how I would feel, most patients see and understand the buy-in reasons really quickly, and you don't have to sell it at that point. You just want them to feel better, and they take your recommendation and run with it. So, I mean, I feel like those are some great options. What do you think, Kevin? Are there any that I missed?
No, I just love that you wrapped it in how does the patient feel. So looking at least some subjective information to be able to tie in, here's what this nutrient being depleted can potentially do to you as a patient. And then being able to grab some subjective information from them on, you know what, I have been having more issues with X, Y, and Z things. And then it can be either a conversation of, like point of care testing or laboratory testing of saying, hey, do you want to examine this further? And we can test this and see what's going on with you. Or, one thing that can be done, and it could be a low invasive, low side effect profile risk, is we can just add on X, Y, or Z supplement, to your regimen to avoid it altogether. And so I think that's a really great way to tie those things in. And we just had a good question from Morgan right here. I'm going to pop it up on the screen for you, Thea, and I'll read it. It says, how do you include these supplements in the retail setting?
I think you get them in from you pick your favorite supplement company, let's start there, and have them on the shelf. And maybe you put them even next to the metformin bottles or next to the birth control, and ask the patient, this is a great supplement and we know this causes it. The drug depletion, this would be a great supplement while you're on this medication, and really help the patient that way. I think I don't necessarily have my favorites in retail. I suppose you look at your profit margins and take a look at what you're gonna your favorite, and then the money side of it. There's always that option, and make it worth your time too, and really try to add this. I also offered to my retail friend that maybe these are things that you post about on social media. And are you taking this drug? If so, did you know it causes XYZ? And you might feel like ABC, and really allow the patient to feel it, and then link up with some online places, even dare I say Amazon, but Amazon, and have it shipped directly to the patient's house, and really get it one stop, even from a social media standpoint, for your followers there as well. So lots of different options, I think. Anything that comes to mind for that question for you, Kevin?
I think you can look at exactly what you're saying, Thea. What are your favorites, or what do you currently carry? Like, what is in stock and inventory for you? And the other piece that I think is necessary for you to be able to do is also look through your salts, right? So instead of them just having to go and pick out a magnesium, right, you can go in and find the appropriate magnesium for what they need. And so I think there's an important little element. We can have a side conversation on the clinical impacts of different magnesium salts, but you finding those. And the next piece for me is, at least when I had my little retail employee only pharmacy in the hospital, I would literally just grab it and put it in their bag. And then I would grab it out and just say, hey, I grabbed this for you. You don't have to take it. You don't have to buy it, but here's the reason why. And so then I just broke it down for them. And that gave me a really good reminder inside there. And I'd usually tag that bag with something to say, here's, Kevin, pull this out and talk to him about it. And so that was my way about going about it, which was a really simple ease into the conversation kind of piece. You can always pull it out of the bag and take it back. But I will tell you this, majority of the time, I never had to. It was always the patient was going, thanks so much for thinking about me. Thanks so much about looking out for these things. Makes a lot of sense to take that. Morgan has another question that I think maybe really appeals to some of the clinical things we're talking about here, Thea, but she asks here about doing that in the clinic and says, I do feel since we deal with providers, we can make recommendations that way within the clinics. And also, she says the same thing in retail. So inside of clinics, Thea, I know there's two different ways that we can go about that. Some clinics carry their own OTCs, like they can carry their own OTCs. They can dispense those for cash-based prices, and they can give those to an individual patient kind of right out the door. Some do, like, have a direct contract or have something connected to a retail pharmacy in their area that they're sending them to, that they're the ones that carry their drugs. And oftentimes a retail pharmacy, you and I talk about making those bonds and relationships. That's a really good way to do it, is call your provider even before the RPM, CCM, RTM conversation even happens. You can call them and just ask, what supplements do you want me to carry? Like, what brand, which ones, so that when your patients come in, I've got it ready for them. And those are really good ways to connect the dots between the clinic and the pharmacy for that piece as well. Any other thoughts there, Thea, on you're an ambulatory clinic pharmacist and how to get involved with the supplement recommendations and nutrient depletion?
Yeah, I mean, I think the doctor detailing is a big aspect. Find out which ones the doctors like. What do they know works? Most of the time, they have a brand that they like because the research is behind it. And in that website that you had pulled up with all the research studies and stuff, I think that goes to show, like, there's data behind it, and that's easy to share with the providers. If you don't have a reference on why this is important, those research things are what the doctors are going to want to see, the proof, the evidence that it is going to be efficient and effective for the patient. So, I mean, I feel like being informed, taking that information to the physicians, and then, being able to take it that one step further and get in touch with the retailers that do carry it. I think it's a great opportunity to really come full circle with what it looks like from a nutrient depletion for the patient, for sure.
Oh, I love it. I love it, Thea. We're running up on time here. We had a couple of really fun announcements coming up. I mean, Thea's always doing really incredible things. Make sure that you join RPH Ally. And in RPH Ally, head over to the Remote Care Services channel. Blow up any questions you have. Ask more. We need to do more remote patient monitoring. We need to do more services. We just heard another news. I mean, Walgreens and CVS, some of the major players out there, they're shutting down stores really soon. And I think with some of those things happening, finding ways to be able to leverage pharmacists in your clinical services in different settings and different care environments is really essential, to the health of our profession. So there's one plug. Get in there, ask those questions, get involved in that space. And the next piece is we have a pretty big soiree happening here really soon. Thea, one of our brilliant speakers that will be there, is coming up on that in July 18th through the 20th. And so we have over 20 different speakers from those many different kinds of specialties talking about all of the clinical involvement in pharmacy that's happening right now and the evolution, plus talking about the future of pharmacy and kind of some really incredible panelists. I'm super humbled to be able to be involved with that. Thea, any parting words?
No, I think I'm excited to see that soiree happen and get everybody in the same rooms for those 3 days. But I think it's going to be a great time. And, I just say, as my volunteer fire department self for the last 25 years, I have to give you a warning. It is 4th of July weekend. Make sure your fingers stay safe and you all stay happy and safe as well. So that's all I have. Thanks so much, Kevin.
Happy 4th, everybody. Talk to you then. Bye-bye.